Hello everyone, we are from Group 1. This is our video about antimicrobial resistance. So please enjoy the video. So this is our member. There are Laili Herawati, Latif Farif Danuha, Latifah Sinaring Narisayati, Lydia Angelita Johanna Sandi, Marsha Laksita Aribianita, Mies Isningrum, Muhammad Rizky Fatifur Rahman. The body's immune system has been fighting infection as long as people have roamed the earth. But sometimes the immune system is overwhelmed by infection. For decades, antibiotics have been our superheroes. Fighting infection when the going gets tough. But every time we using an antibiotic, some of the enemy bugs learn how to resist their superpowers. The resistant bugs they'll multiply in your body and easily spread to those around you and your family and friends. And once the bugs causing an infection have become resistant, antibiotics don't work and we are back in the Stone Age.
Some bugs have already become resistant, but for others there's still hope, but only if you act. It's normal to feel ill if you have an infection. It's just your immune system doing its job and it will usually win. You'll get better without antibiotics, and taking them for an infection like a cold or flu is about as effective as using a fish as a wound. Taking antibiotics for minor infection that will usually get better on their own will make it harder for them to fight an infection when you really need them. So when you really need a superhero, it may be powerless to help you. We take antibiotics for granted for treating infected wounds or chest and kidney infections, and they make surgery and cancer treatment possible. For years, they have helped us. Now it's our turn to guard them. Take care. No antibiotics.
Definition of antimicrobial resistance. Antimicrobial resistance is the condition that occurs when germs or microorganisms such as bacteria, viruses, fungi, and parasites change so that they have the ability to make drugs that treat infections ineffective.
Next is mechanism for acquired resistance. The first is the presence of an enzyme that inactivates the antimicrobial agents. The second is the presence of an alternative enzyme for the enzyme that is inhibited by the antimicrobial agent. Next, a mutation in the antimicrobial agent's target, which reduces the binding of the antimicrobial agent. And then post-transcriptional or post-translational modification of the antimicrobial agent's target, which reduces binding of the antimicrobial agent. And then the 5, reduce uptake of the antimicrobial agent. Next is active efflux of the antimicrobial agent, and then overproduction of the target of the antimicrobial agent, and then expression or suppression of agent in vivo in contrast to the situation in vitro. And the last is previously unrecognized mechanism.
Factors responsible for antimicrobial resistance are patients not finishing their treatment, lack of new antibiotics being developed, poor infection control in hospitals, lack of access to clean water, sanitation, and hygiene, overprescribing of antibiotics, overuse of antibiotic in livestock and fish farming. Prevention and control to avoid antimicrobial resistance. Only use antibiotics when prescribed by a health professional. Never share use leftover antibiotics. Antibiotics shouldn't be sold over the counter.
Thank you for your listening. May all those we have shared be beneficial for all of us.